As life expectancies increase, more and more elderly people get serious problems with their cognition, that's with the way their mind works and the way they think, which can actually impact their ability to go around their normal daily lives. In some situations, these symptoms can be treated and cured, but unfortunately, in far too many cases, they're caused by diseases such as Alzheimer's disease that are currently incurable. It's terribly important that we diagnose and put people onto those treatments and care plans at the earliest stage of the disease that we can.
中国已经全面进入一个老龄化社会，并且呢，老年人口在不断的增长，速度越来越快。比如说呢，到2013年，也就是今年年底，中国将会有2亿的老人；到2026年，当达到3个亿；2037年将达到4个亿。那么就面临着让中国整个社会面临着一个极其严重的一个庞大的社会问题。而当我们同中国的医学专家讨论的时候，我们发现，当前中国有1000万的痴呆人口，但是其中只有很少的一部分数量被诊断了。
Ixico has technology that can make very precise measurements from the sort of brain scans that are collected in ordinary hospitals, and to use those to help work out the causes of poor cognitive health and to match people to the best treatments and the best care and support that they can have. The way our technology is used is that a patient who has some symptoms that they're worried about would go to their doctor, and their doctor would have them referred to a clinic, which might be a community clinic or a hospital clinic, to get their memory assessed and very commonly to have a brain scan. Our technology can take that brain scan and make very precise measurements from it to work out the extent to which there is a neurodegenerative cause of their symptoms or a vascular disease cause of their symptoms. And that can be used to identify the type of disease that causes their problems and to match them to the most suitable treatment and ongoing care plans. In some situations, there'll be good news. There'll be reassurance that there isn't really a biological basis for the disease and that there's perhaps a vitamin deficiency that can be looked at, or perhaps they need some talking therapy for depression, rather than being a neurodegenerative and progressive disease. But where there is an incurable disease, it's still possible, given the right diagnosis, to match people to the best possible treatment and care to maximise their independent life and enable them to live as well as possible with their symptoms.
自从2008年开始 ，Ixico 公司同北京、上海、广州等地国内30多家3甲医院开展起了临床合作。我们已经培训上百名的神经内科、精神科和放射科的医生，并且我们已经为国内多家3甲医院的影像中心提供了资质认证，使其能够开展起针对于脑血管疾病、神经退行性疾病的高质量的临床研究。同时，我们正在同中国的多位医学专家共同合作，开展起针对于中国人群的神经退行性疾病的研究，并且提供于针对于中国人群的痴呆症早期诊断的产品以及服务。
Serious cognitive impairment is a huge problem for society. It's estimated that about 1% of global GDP is used in meeting the cost of caring for the elderly population who have cognitive impairment caused by diseases such as Alzheimer's disease. How do we avoid large numbers of people with dementia being a huge burden on their families and on wider society?
Ixico 公司作为英国首项痴呆症挑战计划的核心成员，我们已经将我们的医学创新技术，针对于痴呆症早期诊断的相应技术，应用到英国的社区，也就是1级医院以及2级的专业医院当中，并且我们正在同 NHS 的相应机构共同努力，对这些技术进行细致的评估，特别是针对于是否对于费用的相应的节省，以及对于诊治的疗效方面。同时，我们非常高兴地注意到，针对于中国老龄事业的第12个5年计划当中，明确指出，针对于老年疾病的早诊、早治 和早干预。同时，我们也很高兴地看到，中国政府已经为老年人的健康事业，特别是如痴呆症疾病，设定了40%的早期诊断的目标。因为早期的诊断，只有早期诊断完成之后，我们才能够谈到早期的干预，才能够让患者以及他的家庭能够有一个真正意义上的高质量的生活，也才能够节省家庭在经济上和各个方面的沉重的负担。我们衷心希望 Ixico 公司的创新技术，痴呆症诊断的早期诊断技术，能够为中国老人的脑健康事业保驾护航。
For China to control the ever-increasing costs of caring for elderly people with cognitive impairment, to enable China to put in place the supports for these people so they can live within loving families for longer, that requires, as a first step, that diagnosis is put in place so that everybody with the diseases can get a diagnosis and be matched with the right care and support.